You know, we're getting, let me go back and talk a little bit about some of the questions that we get about the sequence. Maybe to recap just a little bit, I think it's important to look at what our overall goals are. Our overall goals are several. One is to save lives, to protect people, to protect the most vulnerable. And so as you look at what we're doing in 1A and 1B, there's a great focus on protecting the most vulnerable of our citizens in the state of Ohio. Second, we want to work to protect those who protect us in the healthcare field, those people who continue day after day to be in with COVID patients. So we've devoted a significant number of the early vaccines to them as well as to the nursing homes. And the third group that we will, big group, that we will hit as we move forward in 1B is the whole goal is to get kids back in school. And our goal, as we've said, is get every child back in school by March 1st. That's what our aspirational goal is. So those are the real kind of the pillars. Those are the things that our goals are for 1A and 1B. And now let me go through these just a little bit. Let me start with 1A. Again, nursing homes, other congregate care settings where people live, our medical personnel. We also are distributing some through our health departments. They are out vaccinating people like EMS, people who are working every day and many times are coming in contact with people with COVID, medical personnel, and they're also, the local health departments are doing some congregate care settings. So the vaccines are going out to the nursing homes through our pharmacy company partners, the 4 of them. A lot of it's going out through the hospitals to medical personnel. And then the third big group is going out through the health department. So those are the 3 major groups of providers who are out there working right now to get this 1A group covered. Just to give people an idea of the size, there is roughly 1 million people in 1A, roughly 1 million people in 1A group. It doesn't mean they all get it, doesn't mean they all want it, but there's 1 million people in that group. Now let me turn to 1B that we announced last week. Where our deaths have been the greatest, of course, are among our older members of Ohio society. And Eric, if you can put that up, please. And again, you start at the bottom here. Plus 80 is 53% of the deaths. So 53% of the deaths, 80 plus. 75 to 79 is 14% of the deaths. Age 70 to 74 is 11.9, almost 12. 65 to 69 is 8. 60 to 64 is 5, and on. So we've had people die at almost every age, but if you look at the statistics, the most vulnerable individuals obviously are the older that they get. So again, that I think gives us a pretty good indication of why we're in 1B. We're going to start with older people, and we hope in approximately 2 weeks from now to be starting in. A lot of this depends on how much we're getting in from the federal government, et cetera. But we hope in about 2 weeks to be starting in on this 1B group. Just again to give you some numbers. Above 85 is about 220,000 people. 75 to 84 is about 580,000 people. And 65 to 74 is 1 million people. We also have announced that in the 1B group, we will have approximately 75,000 people who are the most at risk because of a medical condition or situation, who are under the age of 65. And that comes, as I said, to about 75,000 people. We also have another group that potentially is as large as 300,000. That is people who work in our schools K through 12. So we'll be announcing in the next few days how we're going to phase those in. But those are the groups that will be coming up after 1A. Now, to clarify it, some of 1A will be finishing up next week, some the next week after. But some of 1A will continue on for some time. For example, assisted living. Our pharmacy partners will go to assisted living as soon as they get done with the nursing homes. But then by the time you get that second shot for people in assisted living, you know, we're down the road a few more weeks. So 1A will continue to some extent down here. At the same time, we start up 1B and go that way. So I hope that brings a little clarity to what we're doing. But again, the goals are clear. Number one, most important thing is to protect lives. Number two, protect our healthcare workers who are protecting us every day. And three is to get our kids in school. Those are the goals. That's what drives everything we're doing. Eric?